What is frostbite? Frostbite is a medical condition that occurs when the skin and underlying tissues freeze due to exposure to cold temperatures. Frostbite commonly affects the extremities, such as the fingers, toes, ears, and nose, but can also occur on other parts of the body. Frostbite occurs in stages, with the first stage being frostnip, which is a mild form of frostbite that causes numbness and tingling in the affected area. As the condition progresses, the skin may turn white or grayish-yellow and become hard and cold to the touch. Blisters may also form on the skin. Frostbite can cause permanent damage to the affected area, including tissue death and gangrene, which may require amputation in severe cases. What causes frostbite? When the body is exposed to cold temperatures, it responds by constricting blood vessels near the surface of the skin to conserve heat and maintain core body temperature. This reduces blood flow to the extremities, which makes them more vulnerable to frostbite. The risk of frostbite is increased when the skin is exposed to moisture, such as from sweating or wet clothing, which can lower the temperature at which frostbite occurs. Wind chill can also increase the risk of frostbite by increasing the rate of heat loss from the body. Factors that can increase the risk of frostbite include exposure to extreme cold temperatures, especially below 0 degrees Celsius or 32 degrees Fahrenheit, prolonged exposure to cold temperatures, wind chill, high altitude, dehydration, alcohol and nicotine use, which can impair the body's ability to regulate its temperature. Certain medical conditions, such as Raynaud's disease, which causes blood vessels in the extremities to narrow, and diabetes, which can affect circulation, can also increase the risk of frostbite. What are the symptoms of frostbite? The symptoms of frostbite can vary depending on the severity of the condition and the affected area of the body. Frostbite usually affects the extremities, such as the fingers, toes, ears, and nose, but can also occur on other parts of the body. The symptoms of frostbite may include numbness or tingling in the affected area, skin that feels cold or hard to the touch, skin that appears white or grayish-yellow, aching, throbbing, or a prickly feeling in the affected area, blisters or swelling in the affected area, reddened, painful skin, which may be a sign of superficial frostbite, blackened or dead tissue, which may be a sign of severe frostbite. In severe cases of frostbite, the affected area may become gangrenous, which means that the tissue has died and may require amputation. If you suspect you may have frostbite, seek medical attention immediately. How is frostbite diagnosed? Frostbite is usually diagnosed based on a physical examination and a description of the symptoms. The doctor will examine the affected area and may ask about how long the area has been exposed to cold temperatures and whether there has been any previous damage to the area. The doctor may also ask about any medical conditions or medications that may increase the risk of frostbite. In some cases, the doctor may order imaging tests, such as an X-ray, to check for damage to the bones or tissue under the skin. It is important to seek medical attention immediately if you suspect you may have frostbite, as early diagnosis and treatment can help prevent further damage to the affected area. What are the treatments for frostbite? The treatment for frostbite depends on the severity of the condition. In mild cases of frostbite, also known as frostnip, the affected area can usually be treated at home. However, in more severe cases of frostbite, medical treatment may be necessary. Treatment for frostbite may include rewarming. The affected area should be slowly and gently rewarmed using warm, not hot water or by placing the affected area in a warm, moist towel. Avoid using direct heat, such as a heating pad or heat lamp, as this can cause burns. Do not rub or massage the affected area, as this can cause further tissue damage. Pain relief. Over-the-counter pain relievers such as ibuprofen or acetaminophen may be used to help relieve pain. Medications. In some cases, medication may be prescribed to improve blood flow to the affected area or to prevent infection. Blisters. If blisters develop, do not puncture or open them, as this can increase the risk of infection. Surgery. In severe cases of frostbite, surgery may be necessary to remove dead tissue and prevent infection. This may include amputation of the affected area. It is important to seek medical attention immediately if you suspect you may have frostbite, as early treatment can help prevent further damage to the affected area. How is frostbite prevented? Frostbite can often be prevented by taking appropriate precautions when going out in cold temperatures. Here are some tips for preventing frostbite. Dress appropriately, stay dry, limit exposure, stay hydrated, avoid alcohol and nicotine, and be aware of warning signs. By taking these precautions, you can greatly reduce your risk of developing frostbite.